welcome back to my channel. My name is Damilola. I'm a mom who loves to share tips on how to better understand our babies so we can worry less. I also share tips on motherhood and my journey so far. If you are a returning viewer, a returning subscriber, thank you so much for coming back. I'm so glad to have you back here again. And if it's your first time watching this video, oh God, thank you for coming. Please remember to subscribe and also click on the notification bell so you'll be the first to know anytime I drop a new video. Today's video is about breastfeeding. I'll be sharing tips that I used that helped me prevent sore and cracked nipples. Like, is that possible? Yes, it is. For most first-time mom, they said it is inevitable for your nipple not to be sore for the first time, or for you to have cracked nipples and all. But here in today's video, I'll be sharing things I did, procedure I did that helped me prevent the sore nipple. Let's dive right into the video. Number one was my sitting position. Sitting position is like very key when it comes to breastfeeding. If you don't have a separate chair that will help you sit right, like a plastic chair which I used, and you are sitting on a cushion like this, number one thing you need is a pillow for your back. It helps support your back, your waist, your shoulders. That one first has given you an upright sitting position. And if you are short like me and you need an extra support so your leg won't be stressed, your knee area, just get a stool and put your leg on the stool. By doing this, you are supporting yourself. You're already sitting upright. You are preventing waist pain, back pain, shoulder pain. Once those pains are out, some of your problems are solved. The next thing that I did was using a breastfeeding pillow. Now, some people say they just fine with using normal pillow they used to sleep. It wasn't comfortable for me. I tried. Oh God, I struggled using normal pillow. But once I started using my breastfeeding pillow, number very important thing that this pillow helps with is the moment you put it around you, you already feel like once you put your baby on it, your baby is already elevated. There's no need for you to start adjusting your hand this way to start breastfeeding. No, once your breastfeeding pillow is there, it already gives you an elevation, and the right elevation for your baby. Another thing about breastfeeding pillow is getting the right size. There are some breastfeeding pillow that are quite smaller than the other because we are different. They are petite human being and they are big size like us that can use this breastfeeding pillow. So make sure that when you're getting your breastfeeding pillow, you get the right size. Number two is make sure your baby make sure your baby lashes right. Make sure your baby's lashes right. What do I mean by lashing? Make sure that your nipple is in the right place, like your baby is sucking well. Make sure that when your baby is sucking, they have this round mouth. See the way my mouth is, like they are sucking like this. Not that this part of their mouth is. They tried to learn while they were in the womb, but when they came outside, your nipple might not be as tiny as their finger that they used to practice while they were inside of you. For someone like me, I had so you have to make sure your baby is lashing right, because once your baby is lashing right, it helps prevent cracked nipples and sore nipple. Yeah, it helps a lot. How do you make sure your baby is lashing right? When you are breastfeeding, make sure that not only your nipple is in your baby's mouth, your areola, the black part of your breast also, try to push as much as possible in his or her mouth. That way they have enough to suck with, and by doing that they are not putting tension and stress on your nipple. So once they are like that and their mouth is like this and they are sucking, very well, you see you will not feel that much pain, because as a first time mom, because you've not breastfed, there's this small pain you are going to feel, but it's not the one that you have to feel throughout the breastfeeding period. It's just a very small sensational pain of once they open their arm, and that should be all. And if the pain continues, that means your baby is not latching right, and it means you can remove their mouth from the nipple. Now, trying to remove their mouth from the nipple is another tip. So that should be number 4. If you are removing your baby's mouth from the nipple, don't just pull your nipple out. That if you pull it out, you are stressing your nipple, you are like stretching it unnecessarily. All you need to do is just open their mouth, their upper lid like this, or you stylishly put your hand, make sure your hands are clean, into their mouth and use it to raise it up and open the upper lip like this. Naturally, your breast will slip out of their mouth the moment you just raise this up, because they don't have that much hold on it again. Your breast will slip out of their mouth, and you can reposition your breast milk. This tip I just told you, this is my number 4 tip. It was life-saving, like literally life-saving. I didn't have to pull my breast out of her mouth. I just have to open her lid up gently. The moment I do that, my breast is out of her mouth. Then I can readjust and make sure she's latching well. Make sure your baby is latching well. If they don't latch well, that's where those sore and cracked nipples come from majorly. Number 5, when you finish breastfeeding, make sure to moisturize your nipple area. You can either use a nipple cream, or use shea butter ori, or you can use Blue Seal Vaseline. Use this to moisturize and oil your nipple area. This also is life-saving. I wasn't consistent with it, but I did it and I could see the effect. I didn't have any cracked nipples, I didn't have any sore nipple. I hope these tips were helpful to you. If they are, please give us a thumbs up. If you have any questions about breastfeeding, or you're having challenges about it, please go to the comment section and ask. We will try to respond to your questions as soon as possible, and share with your friends, your pregnant friends, your baby your friends who have had babies, or those that are expecting, because you don't know who might need these tips, because it is actually life-saving. Till we come your way again, keep loving yourself, because we need a sane you to take care of our baby, and also keep taking care of that little angel that you have with you. Bye.